Hi everyone, Dr. Hall here, and I'm going to take you through the structures in the superior mediastinum. So I've already gotten started with the trachea and the left and right main bronchi. The bifurcation where the trachea branches into the two main bronchi, this area right here is called the carina. That's the C-A-R-I-N-A, so that's the carina right there. The right main bronchus usually has a more of an inferior angle than the left main bronchus, which is interesting clinically because if you accidentally get something down your trachea, if it's going to fall into one of the bronchi, it usually will fall in the right main bronchus. So if we're looking for a little bead or something that a child has choked on, that's where you're going to look first. So you can also see my kind of candy cane here. This is supposed to represent the aorta because in fact the descending aorta is going to travel posterior to the root of the lung, posterior to the hilum, posterior to the bronchus. So now I've got it curving and coming up around. But there's another structure, of course, that's going to go through here, and that is the pulmonary artery that's going to the right side. So I've got here my pulmonary trunk, which is going to branch into my two pulmonary arteries. And so that kind of sneaks through just like that. And you'll remember in the heart, the pulmonary trunk is anterior to the aorta. So we have this kind of little twisty configuration here. So my pulmonary arteries are then going to travel out to the two lungs along with my two bronchi. So the next structure we're going to do is a new one to us. This is the Azages vein. So the Azages vein is collecting venous blood from the thoracic cavity, and it's also going to pass posterior to the root of the lung, and it's only on the right side. And then it's going to come up and drain into the superior vena cava, which we haven't done yet, but it's a really posterior structure, so I wanted to get it in there. All right, so next we're going to do some of the other arteries coming off here. So of course, the first artery, the first main artery coming off of our aortic arch here is going to be the Brachiocephalic Trunk. So the brachiocephalic trunk is going to come off of our aortic arch and travel out to the right side. The next artery off the aortic arch is going to be the left common carotid artery, and that's going to travel superiorly up into the neck. And then the third one is going to be the left subclavian artery, which is going to travel out to the left. Okay, so our brachiocephalic trunk is then going to branch into or give off the branch of the right common carotid artery. And once it does that, so this is the brachiocephalic here, right common carotid, then this continuation is the right subclavian. So we have some asymmetry here because we're going to have some other structures over here. So we needed to use that brachiocephalic trunk to just kind of get out of the way a little bit, and then we could branch into the common carotid and the subclavians. So the next structure we're going to add are our vagus nerves. So you might remember the vagus nerves come from up in the neck. So on the left side, it's going to travel along the aortic arch. And you'll recall it travels posterior to the root of the lung, posterior to the hilum. You'll also recall that it's going to send off a branch called the left recurrent laryngeal nerve that's going to branch this way. Let's see if I can do this. See if I can sneak that through there. Whoops, sorry. It's going to, all right, not the best plan. Okay, and then travel up along the trachea to supply the larynx. So let's try to put this back together. All right, and there we have it. Boop. Okay, you also will probably remember that the landmark for finding where this branches is the Ligamentum Arteriosum, that fetal remnant from the ductus arteriosus, which goes from the pulmonary trunk to the aorta, aortic arch right there. Okay, so that's a little too big, isn't it? So we have our ligamentum arteriosum right there, a little bit. So we also have a vagus nerve on the right. So the vagus nerve on the right is going to also come from up in the neck near the common carotid artery. It's going to travel anterior to the subclavian and then posterior to the root of the lung, just like the left one. Next, we're going to add our phrenic nerves. So you'll recall that the phrenic nerves originate up in the neck, but a bit lateral to the vagus nerves. They're going to travel anterior to the artery and then anterior to the root of the lung. So they're going to go anterior to the pulmonary vessels and the bronchus. Ooh, let me add a little bit more pulmonary artery here so you can see that clearly. Okay, so remember the phrenic nerves travel anterior to the root of the lung. The vagus nerves travel posterior to the root of the lung. So now it's time to add our other veins. So I've already put together a superior vena cava with, let me turn it this way, yep, with the veins draining into it. So that's going to be here, our Azages vein. Remember our Azages vein is going to drain into that superior vena cava. The veins are anterior to the arteries. And so we have, draining into the superior vena cava, we have the brachiocephalic on the left and on the right. So whereas for the arteries, we only have a brachiocephalic on the right, for the veins, we have it on both sides. The internal jugular vein is going to drain into the brachiocephalic, and they run along with the common carotids. So, like that. So, this part out here is the subclavian vein. And then, once the blood from the head joins in, then it's called the brachiocephalic. Same thing on the other side, subclavian vein. Once the blood from the head comes down through the internal jugular, then it's the brachiocephalic, and then into the superior vena cava and into the right atrium of the heart. I just realized I forgot to include the internal thoracic arteries, because here they are sitting right in front of me. So our internal thoracic arteries are going to come off of our subclavian arteries. And you'll recall that they're going to travel down either side of the deep surface of the sternum. Internal thoracic arteries off of the subclavian. And they're going to come out to run either side. There are also internal thoracic veins that will, of course, run alongside of them. All right, so I think those are all the structures that we have on our list for this today. So I'm going to review them with you. So here we go. Our most superficial structures are the veins. So we have the subclavian vein, internal jugular vein, and brachiocephalic on the left. Subclavian, internal jugular, brachiocephalic on the right, both draining into the superior vena cava. We also have the internal thoracic veins draining into the subclavian veins. So now I'll remove those. And we can see that we had the Azages vein here. I don't know if you can see that because the angle of the camera. The Azages vein was also draining into the superior vena cava. So now we can see, let's look at our nerves. So the most lateral is the phrenic nerve, which is going to travel anterior to the artery. It was posterior to the veins and then anterior to the root of the lung. Here's the left, here's the right. Our vagus nerves run up with the common carotids and the jugulars. The left one is going to run along the aortic arch, then give off the left recurrent laryngeal nerve with that landmark of the ligamentum arteriosum. The internal thoracic arteries come off of your subclavian arteries. And let me move these out of the way so we can see a little bit more clearly. there and there. And it looks like I forgot the right recurrent laryngeal nerve, so I'm so glad we're going through this. So of course, here's our pulmonary trunk with the left and right pulmonary arteries. And let's go ahead, and I'm just gonna move these out of the way so that you can see a little bit better. So I'm gonna cut my aorta there. Okay. So we need to do the right recurrent laryngeal nerve. I knew I forgot somebody. So that, just like on the left, is going to branch off of the vagus nerve. Now we don't have an aortic arch to loop under this time. I'm going to move my internal thoracic artery out of the way. So instead, we're going to loop underneath the subclavian. So my right recurrent laryngeal nerve is going to branch off of my right vagus nerve, loop underneath the subclavian artery, and then travel back superiorly up to the larynx on the right side. Okay, so I'm going to move that Azages vein so that you can see that a little bit better. Okay, so here's the right vagus, right recurrent laryngeal, and then the right vagus continues down posterior to the root of the lung. And so the only structures we haven't talked about then again in review is just the trachea with the two main bronchi and the carina in the middle. I hope that helps. Thanks.